Everyone, and welcome to this month's Insider Access post. Today I wanted to go over the extension rotation syndrome in the lumbar spine. So one of the things you'll kind of see with your patients presenting with it is low back pain, typically on more of one side than the other. It can be just one side or it can be both sides, but still greater on one. And the pain will be greatest with both lumbar extension and any rotation to that involved side. Typically, rotation the other way, they may feel an improvement of symptoms from opening up those facets. As far as how to treat it goes, your number one focus should be with their daily activities. So if they're sleeping and their back is in a twisted position, you want to try and correct that so things are in alignment. If they're sitting at work and they're having to repeatedly turn at a computer, that's another thing that you want them to correct. So maybe teaching them to either realign their work setup or turning their whole body in their chair, if it's a rotational chair, to accommodate for decreasing the stress on the lumbar spine. Now, to couple that, you also want to address some exercise issues as well. And you want the main focus, as this is a rotational problem, is addressing the rotation dysfunction. So one of the things I'll start with is doing a bent knee fallout and having the patient really focus on, as they drop their leg to one side versus the other, that they don't get excessive rotation coming from the pelvis and the lumbar spine. And the patient initially, when they do it, will experience pain as their leg drops to the outside because they're not going to be able to stabilize there. And if you either manually or they actively stabilize their spine so that it's just coming from their hips, then they'll immediately notice a decrease in their pain and an improvement in the mobility as well. Now that's one of the lower level exercises to start with. You can also move to prone and have them practice just rotating their hip side to side, teaching them to really try and focus on not getting any lumbar motion at all. This should be purely hip, because we want to teach these patients how to dissociate hip from lumbar motion. And then another one that I'll use for progression is in the quadruped position. You may have seen this in my quadruped video before, but keeping a neutral lumbar spine, trying to rock back and really focus on what you'll see from a posterior view or an anterior view is that their spine might try and rotate one versus the other as they're rocking backwards. And to compensate or to correct that, you typically want to just try and cue the patient, really try and focus on keeping this spot in the spine neutral. Or you may need to bring the hip a little bit into abduction and external rotation as they sit back, and that'll decrease some of the strain through there. So try and take a look at that when you have some of your lumbar patients, especially if they're presenting with just pain on one side and it's increased with extension and rotation.